recording is going and video is going, and it looks like we're all set up over there. Hello and welcome back to Shun for Good Reason. I'm Anna.
And I'm Tess.
And I have the fuzzy blanket.
And I could be on too. It could be like, we were shunned for good reasons. You'll have to figure out what those reasons are.
Ooh, I love that. So what do we do? Do we have like... I feel like this would work best as like a Wheel of Fortune.
What?
And then... Well, because then everybody has to spin and then they have to like fill in the blanks for why they think we were shunned. And if they're right, they're right. And if they're wrong, they're wrong. But they can always go spiritually bankrupt if they spin.
Go spiritually bankrupt. Oh, no.
I feel like that makes
But
sense.
like, aren't all the reasons the right reasons?
Well, yeah.
Or the wrong reasons?
Or the wrong reasons. Because like, weren't we just talking about how shunned for good reason? It doesn't say that we shunned or did the shunning or got the shunning or somebody else.
Yeah, right. There's
all the reasons.
It's so relative.
Everything is relative to us. That's probably why we got shunned. It's because we think everything's relative.
That's right. We gave in to the, what did they call it? Oh crap. What did my dad call it?
Spiritual bankruptcy.
Well, yeah. But specifically when we were talking about like moral relativism and stuff, there was a label they would slap on things. Oh man, I can't remember what it was. It's bad radio.
It is
I
bad
can't remember
radio.
what it was called.
You can't remember what
Or
spiritual
what they called
bankruptcy
it.
was called?
No. Specifically when we would talk about moral relativism and of course they lumped like, you know, gender stuff into that and homophobia, and that was all part of moral relativism. And not praying in schools, that was always part of moral relativism.
I'm Googling Christian.
New Age!
Oh,
New Age!
Yeah,
That's
there
what
we
they
go.
would say. They would say that
Oh,
New
that's very
Age
New
moral
Age.
relativism stuff.
Yeah.
Yeah.
New Age of Aquarius.
They had no idea what New Age was, and I still probably don't really know.
You know, that's fair.
They're teaching all that New Age crap at schools.
Right, those stupid schools. Their
Yeah.
moral relativism.
Then we're right. We all know what right and wrong is, and the world is black and white, and good versus evil. And
Anybody who says different is selling something.
that's right. Now you're quoting the wrong movie.
Oh, damn it. I do that all the time. Which happens every year.
You quoted The Grinch. I don't know if I've ever heard you quote The Grinch.
That wasn't the Grinch. That was Sid from Ice Age.
Oh, you're right.
They left to help me. They do this every
You're right.
year. Why? Doesn't anyone love me? Doesn't anyone care about Sid the Sloth? It's not the Grinch.
Carl, he ruined our salad.
Dandelion. I love it. I love it very much. That's one of my favorite movies of all time, actually.
That's a good
But it's bad though because that was a New Age movie. You can tell because the humans don't actually talk.
Ironically, I watched it for the first time at a church event.
And there's mammoths. And as we all know, mammoths are not real. They are a tool of the devil.
That's right. To
Hidden
convince
in
you
the fossil
evolution
record.
is true.
Exactly.
Yes.
We all know this. Truth. Everybody knows it. When we make t-shirts, one of them will say truth. Everybody knows it.
Everybody knows it.
Tess, how was your week?
Long.
Same.
It was painfully long.
Same. I do think that the highlight of the week, though, was a patient with aphasia. And for anybody who does not know aphasia, in the left side of your brain, there's two areas. One is called Broca's, one is called Wernicke's. And Wernicke's, fun fact, Wernicke's encephalopathy is what happens when you have really weird understandings of life, the universe, and everything, often due to long-term alcoholism. So,
Crap.
that one's fun. Wernicke's area is where you understand speech, and Broca's area is where you express speech. So if you have a dysfunction in Wernicke's area, it's usually called receptive aphasia. You don't necessarily understand what people are saying to you. When you have a dysfunction in Broca's area, you may or may not understand what people are saying to you, but you have trouble expressing, excuse me, but you have trouble expressing either word finding or something of the sort. And this man was absolutely adorable. He had expressive aphasia. So we asked him what he wants for breakfast. And he goes, "Oh, yes. I would like 2 blackberry bourbon." And the nurse working with me is like, "You mean blueberry?" "Ah, yes. 2 blueberry bourbon." She says, "Bourbon's not a breakfast food." He goes, "Ah, yes." She goes, "Do you mean pancakes?" "Ah, yes. 2 blueberry pancake." So she helped him dial the kitchen so he can order his breakfast, and they pick up and he goes, "Ah, yes. I would like 2 blueberry brewski." She goes, "Do you mean pancakes?" And he goes, "Ah, yes. I would like 2 blackberry bourbon." So my friend nurse had to get on the phone and say that no, he's not trying to order alcohol. He really just wants pancakes.
He just wants pancakes. Don't we all?
I know. It was adorable. It was so cute. Oh, yes.
Oh, yeah.
That was wonderful.
I've been watching The Daily Show, and one of them did an impression of Tucker Carlson.
Oh no.
I know, but I things keep happening, and he does this thing where it's like, "What happened? What's going on?" And so life happens and it's going on, and I just keep hearing this parody of Tucker Carlson. What happened? It's not The Daily Show, it's SNL.
Oh.
SNL did it. What happened? What's going on?
We don't know, Tucker. We're just trying to figure it out too. I'm so sorry, Tucker.
Anyway,
Oh.
when you're saying, "Oh yes," my head is going,
yes.
"What happened? What's going on?"
What's going on here? Oh gosh. What's going on and what happened to us is that we are talking about the evangelical response to COVID-19.
Good times.
Good times. We had so much fun. So we left the church for realsies in September of 2019.
Yeah.
Which was so nice because we got to miss out on a lot of the sanctimoniously. Sanctimoniously is a
Can
really
you
good word.
imagine
No, I
if,
cannot.
we had no idea. Like we just had no idea. I haven't even really
that was
thought about
such-
it much, to be
Such
honest,
good timing.
till right now.
I am grateful every day that I was not in the church in 2020.
Yeah, that would have been awful.
Yeah.
For us specifically,
Yeah.
gosh, we dodged a big old bullet there.
Yeah.
I mean, I just feel like we dodged a big bullet by leaving the church in general, but
Oh,
woo!
we did, yes. But that was one of the big ones.
Yeah. And just barely too, we were right under the wire.
We were right under the wire. That was woo. That was some timing for you right there.
Yeah.
So, in preparation for this episode specifically, I made Tess watch The Essential Church, a documentary about John MacArthur and similar pastors during the COVID-19 pandemic. And
With their bias, I should.
oh yeah, it was made by them, by
Yeah.
Grace Productions or something.
Grace
It was-
Production.
I know.
I want to take the word grace back so bad, and I'm so bad at it
You
in my own
know,
life. I know I'm
That was a
rabbit
rough
hole in
watch.
Here, but anyway,
it
yeah.
was not a Grace.
It was a rough watch. Yeah, no.
And
I was very uncomfortable.
our children watched it with us, and they just spent the whole time going like, "What? What?"
What's
What?
happening? What's going on?
Exactly. And at one point, one of them was perched on the edge of the couch, watching from between their fingers, being like, "Oh my God, they did what? That's not how statistics work. So that was fun. I really enjoyed that. Do you remember the exact moment when you realized COVID-19 was actually a serious problem?
Oof. That's a good question. I feel like it was kind of a series of moments for me, more than one. I'm trying to rewind it all the way back to like a beginning moment. Mostly, I remember. The moment I remember is like driving to work and listening to the radio talk about it a lot, and then like the roads being really empty because I was an essential worker, so I was still supposed to go to work, and then at work I was doing captioning, and so I was hearing people talk about it on the phones, and so it was kind of I guess that's why I have a hard time distilling it to one point because it was just like this culmination of hearing it in my own life, like on the radio and at home, and then going to work and hearing people all over the country like have it sink in that this was a real thing. And then I think all that led up to the moment I suppose I think of when it really like hit me like this is crazy was when I went to Costco, and it was just like a totally different place, and like everybody was really nervous. It was probably this was a little bit into it, like a couple weeks in, where enough of us were brave enough to go to Costco because we had to, and they had like they were trying to come up with rules, and they were trying to get us to stand 6 feet apart in line, and everybody was so quiet. I think that was the thing. Like it was just so quiet. There was lots of people. I mean, more, probably average number of people for Costco, but it was just so quiet in there because everybody was so nervous about doing the wrong thing and getting too close to somebody, and everybody was wearing masks, which that alone was a big thing, at the time. And so anyway, yeah, that moment really stood out to me. That's like, wow, this is significant. Yeah. And there was part of me that was like, that was probably the most worried I've ever been in a store, that like somebody would like do something crazy. Like I think that's part of the reason everybody was so quiet is because we all thought somebody would do something crazy, right? Because there was like the whole toilet paper scare, and there were all sorts of stories floating around about people doing crazy things, and so I think like there was this like that was a big like there was first of all a whole bunch of new rules, and then everybody was worried about somebody doing something crazy, and we're all wearing masks and can't see each other's faces, and it was just weird. Very surreal. It was a very surreal shopping experience that I'll probably never forget.
Yeah, it was scary stuff.
Yeah. What about you?
Yeah, I'm trying to think of what my experience was there because we had just moved to Colorado Springs.
Yeah.
And I was working in a hospital. That's why we had moved out here.
Yeah.
And I had started working probably like 2-3 weeks before the first mask mandates went out.
Yeah.
And then suddenly everything went quiet. There were no visitors allowed. People started getting really sick. And I was working in a float pool at the time, so I could work anywhere they wanted me, out of 4 hospitals, any unit, any floor, anywhere they needed help, they would call me in, and they called me into what's my unit now, 5 Central, and we had a death, and it was the first specifically COVID death in the state on a day that I floated there. And usually when we had deaths, we would wait for the family and make sure everybody got to say their goodbyes. But we couldn't do that anymore. It was probably one of the saddest deaths I've ever seen, and that was because there was no support, and all these people started dying alone. There was one day that it was probably like 2-3 months into it, it was the same floor again, and I had to go down to our central storage because we had run out of body bags. And I was like, well, how many can you give me? And they were like, we have 3 left. For the whole hospital, we had 3 body bags left. And there was one day we had probably 8 people that we thought were probably going to go out that day, like die that day, and we didn't have enough body bags for all of them. And at that point, we had to get a new system for bringing bodies down to the morgue because there were just so many of them. So previously, the nurse and or CNA that was taking care of the patient would help transport them down to the morgue, and we couldn't spare people for that amount of time anymore. So that was a huge thing. And then the farther and farther we got into it, the sicker and sicker people started getting. And one of my primary jobs was sitting with people to make sure that they wouldn't accidentally kill themselves by taking off their oxygen. And if those people stood up out of bed to get to a little toilet we put next to the bed called a bedside commode, you would stand people up maybe 5 seconds, 3 to 5 seconds, stand them up and sit them down there. And while they were trying to pee, they would drop from oxygen saturations in the 90s, which is where we want them, to oxygen saturations in the 40s. And a lot of them would pass out. I'm still scared to get people out of bed. But I would just watch people die.
Yeah.
Essentially was my job for the longest time.
Well, that, like, it's such a contrast between the story you just told and, like, the documentary we just watched about how people in the church were seeing this go down.
Yeah.
Right? Like, I feel like we had the exact, like, the experience we could have had in COVID if we'd stayed at the church was the exact opposite of what actually happened with you working at the hospital during COVID.
Yeah.
Right? Like, we had the almost exact opposite narrative of you daily experiencing the reality of what COVID was actually doing to people.
Mm-hmm.
And, like, just you were talking about how, it was like the saddest death you've ever seen because people couldn't be there, which rings true with, like, what the church people were so mad about was people couldn't get together, right? That's what the church people were mad about.
Absolutely.
And it is sad, right? But it's the reality of this particular disease, and the devastating nature of it was because of what the disease is. Unless you want more people to die, you can't be around people.
Yeah.
Right? Like, and like that, and it's amazing how distorted that narrative got the further from the hospital you were, and you could just blame it on the media. But if you were there watching it happen.
Yeah. Well, it's been hard this week too, specifically this week, because hantavirus has been a scare in the media. Every time you turn on television, hantavirus is there. And I don't know how bad hantavirus is or is going to get. Nobody really does at this point. It doesn't seem like it's going to be as bad as COVID, but that turning on any television or news source and hearing virus, contagion, lockdown, this, that, the other thing, it rang so many of those familiar alarm bells that we had in COVID. And then we were so short-staffed and so many people were getting admitted that every regional hospital one day this week had to have their daily safety meetings, which we always have, and they told every single office worker who still has an active nursing license, shut off your computer. We don't need you in an office. We need you helping. So all the managers and associate managers and anybody else who still has an active nursing license was shuttled to the floors to help us because we were so short-staffed and so overexerted. And that was, woof.
Right.
It put us right back. Everything went deathly silent like it had. And we didn't have the visitor restrictions, which is nice. We still had people there, but
right? Because it wasn't hantavirus related.
It wasn't
just,
hantavirus related.
yeah.
It was just that combination of a very high census of patients with those alarm bells ringing of everything's probably going wrong right now, which the news often does.
Yeah.
That called a lot of us back to that, and you could see staff workers just getting that 1,000-yard stare throughout the course of the day because their bodies were just experiencing it all over again.
Yeah.
It was a long week.
I feel like not many people had that perspective on COVID, though.
Yeah,
I
a lot
mean,
of them
all
don't.
health professionals do, obviously,
Yeah,
but
yeah.
most people outside of that have no idea.
Our baby nurses, our new grads, every now and then will just be having a very uncommon downtime. They'll be like, "Oh yeah, a few of you worked COVID. How was that?" And then everybody's face changes entirely, and everybody is just pretty much simultaneously says, "Yeah, that was hell."
Yeah. Yeah. Because it was bad.
It was bad. It was very bad.
Yeah.
But the churches, specifically MacArthur and the related churches, they did not view what was happening as a public health crisis because public health is not a part of their theology. They viewed what was happening as the government attempting to assert control over who can gather and when and how.
Right. They viewed it as persecution.
Exactly.
Oh, man. Sorry. I don't know. I shouldn't laugh, but
No, it's okay
so
to
ridiculous.
laugh. It was pretty ridiculous.
Well, it's such a self-centered way of approaching that. Right?
Yes.
It's making this literally worldwide pandemic where I don't know the numbers off the top of my head. Many people died about you.
Yeah. But in their mind, God is better than a virus. And they didn't have anything to fear. And it was interesting to watch that documentary, the Essential Church that we're watching today, because what they did was go back and essentially rewrite their theology.
Yeah.
To say that, no, this is God's will, is for us to meet in these places at these times for these reasons. And if you don't believe in that, that's because the society is trying to get you to follow the state instead of the church. Whereas previously to that, we had been in this nationalistic space where, especially after World War II, we had been in this bubble of church and state are inextricably linked. Technically, they're separate, but we need to follow what the government tells us to do. We're under the law and under God, but we live in this system, so we have to pay our taxes and do what they tell us to do, and it's all fine. But as soon as they viewed what the government was doing as any sort of control over the church, the control being wear masks, sanitize your hands, stay 6 feet apart, don't meet in large groups and sing because you're spreading viruses, they viewed that as the state attempting to take control over the church and usurp God's plan for Christianity.
Well, they use the narrative that gives them the most power.
Yeah.
Right? Like, it is so post-New World War II, the narrative is honor the government, respect it, because they're taking care of us, we'll take care of them, essentially, is kind of how that went.
Yep.
And then when the government had to respond to this pandemic, the churches reacted by having to change the narrative of, oh, the government's not on our side anymore, and so we have to rewrite the narrative to where we're not separating ourselves from the government. We're saying that God is more important than the government, and we need to double down on having more control of the government, essentially, so that they can be on our side again. Because they're not on our side now, so let's make it so they will be someday.
Right. Well, and a lot of this had to be reactionary, essentially, because people could not come out to church
Yeah.
But if people aren't coming out to church, you're not getting tithes.
Yeah.
So the church is going
They
to go
didn't
under.
talk about that in the documentary.
They did not talk about that in the documentary, and they didn't talk about it on purpose, because the best way to make sure that you are getting funding is either by seeing people in person and pressuring them into it, or by making sure that your cause is just enough and righteous enough that people will continue to support you. And since they didn't have the in-person guilt to work in their advantage, they had to switch to, we are being persecuted specifically, and your monetary contribution is going to make sure that God's will perseveres in America and Canada and wherever else they were doing this.
Yeah.
It was very interesting to see the parallels that they drew in that documentary between Scotland and America.
That was interesting.
Yes. Because they wanted to co-opt that Scottish anti-nationalist religious persecution complex
Right.
that John MacArthur and others see from their very favorite theologians of all time.
It's so confusing to me though that it's so like how they tie the they put forth such strong anti-nationalists, this like dissent and rebellious, and we're the underdog thought process is, you know, is what they really leaned heavily into, especially during COVID. But then the whole MAGA Trump thing is so nationalist.
Yeah. And that's why you have to make that divide, because you have to believe that the right and the left are entirely different, and that public health is something that the left is concerned about as a tool to make sure that you're not being nationalist in the right spot.
So we're anti-nationalist unless it's our nationalism.
Well, and that's part of the Trump thing as well, though. We're nationalist, and these people have come in and corrupted our nation. That's why we need to drain the swamp. We need to go in and root out all of these people who have made our country less than what it is. They're trying to bully you, and we're doing our best. Thank goodness we're here.
Right. And to be clear, I tie evangelicalism to Trump because 80% of evangelicals voted for Trump in 2016.
Yes.
It is not a stretch for me to tie these things together.
I don't think anybody would believe that it was a stretch at this point. Another interesting thing from that documentary was a pastor in Canada who got a lawyer involved before he even started services up again, and then asked that lawyer, could I get arrested for this? And the lawyer said, well, yeah, probably. So that pastor went to the prison and turned himself in, refused to sign any paperwork they gave him because that would be succumbing to nationalism in some weird way. And then they said, yeah, we'll keep you for 2 weeks as a quarantine, and then you can go where you want. And it sounded like he told them, well, I need to go to prison. And they're like, okay, fine. Do you want General Pop or do you want Max? And he was like, oh, I'm going to go with the rapists and pedophiles. And then Tucker Carlson, of course, on Fox News.
What's happening? What's going on?
He does his...
That's ironic.
He does, I know, but he's so involved in it. He does all of his interviews, and he's like, yes, this pastor is in maximum security detention because he dared to preach the gospel. Never mind that this dude preached maybe 2 sermons. Never mind that this dude turned himself in. Never mind that they were not looking for him in the first place. That it was a publicity stunt to make sure that they could spin it to where Christians are being persecuted by people who believe in science.
Right, well that's the whole narrative, right? That's the whole COVID-19 evangelical narrative, is that this whole thing is just made to persecute us and make our lives worse. And the deep state, whatever they call it, liberals, Democrats, Marxist, socialists, they kind of just have this whole list of things they throw on, you know, the the thing they're against, right? That's the evil, that's the bad, and those are the people who are trying to keep us in our homes and away from church, and we're being persecuted. And so anything that forwards that narrative of persecution is good for them, which is confusing on its face. but they like so much of evangelicalism is this tale of they're the underdog that's been persecuted through all of history, right? That, you know, they tie themselves to Israel and the Old Testament, and they were the underdog fighting against Baal and all the pagan gods, right? And then and then as you go through history, it's just always they tie themselves to the underdog story. And then even, especially, you know, you get to the Protestant versus Catholic narrative, and that's an underdog story of the spunky Protestants fighting the big Catholic Church, right?
Yes. Or the Anglicans.
Right, yeah. It's again, but it's always presented as an underdog story. And that just continues, you know, all the way through to now, where like, and so to the point where like they feel like they have to present it as an underdog story in order for it to be real and true and right. We're the underdogs fighting against the man, and we'll make it up if that makes it look right. Right? Like we'll just we'll fly in the face of science and the fact that this disease is killing people just to make us look like the underdog.
Yeah.
In fact, and that's what they did. They were just using this, you know, horrible thing that happened to try and make themselves look good. Which is like I said earlier, was so self-centered.
Yeah. And it's so sad.
Yeah.
That was the thing.
Yeah. Well, and it's the whole reason we left the church, right? Because we decided long before we actually left the church, we came to that realization that loving your neighbor as yourself was actually this important thing that humans should do.
Yeah.
Which is, again, ironic because that comes from the Bible and church history and even church philosophers.
Right,
is where we got this thought process.
Their argument, though, was that you're not loving your neighbor if you can't tell them about Jesus.
For sure. For sure.
Yeah.
Yeah. But again, it's amazing how easy, though, it is, from my perspective, to see, oh, you're just tying it to numbers.
Yep.
And people being in your church. That's what they tie loving your neighbor as yourself to.
Outrage is what makes religion powerful.
Yeah.
So part of it was, you're not going to let us get together and talk about God, so obviously you're against us and you're the Antichrist.
Right.
And then masks were a big deal for Christians.
Oh, yeah.
Because they viewed them in a lot of different ways, but some of them were, masks are covering your true humanity, and this is why a lot of people didn't like actors in masks in my growing up years. So you're actually channeling a demon entity if you're covering your face like that. And another one is you're trying to make us all Muslim because Muslims cover their faces, and you're just trying to make it easier for the Muslims to take over America.
Gosh, I didn't even think about Muslims. So many things Christians are scared of.
There's so many things Christians are scared of.
But I mean, that's my takeaway from that. It's like, it's just this fear that people are trying to. It's a weird cycle of, I'm scared people are trying to destroy me, and I want to feel like people are trying to destroy me because that makes me feel more holy. Right? Like, it's this weird circular reasoning that feeds itself.
Yep.
Over and over again in all sorts and kinds of ways, right? The Muslims are trying to destroy or just invade us, and the the Marxist socialists are taking over the government, and it's this fear that also underlies a fear of not being persecuted.
Yeah.
Right? Like there's this fear
Well, because
that
you have to be persecuted, otherwise you're probably not doing it right.
right, you're not holy enough. You're not
Yeah.
being persecuted. I don't know. It's it's crazy. I had another thought that I forgot.
Well,
But-
no, that's fine.
It is crazy. Like that's the whole thing. Like it's a crazy way to live your life. I need to be persecuted. I don't like being persecuted. But it works out well, for like hating people.
Yeah.
That's my big takeaway, I guess, is that like it's a really good system if you if you need to hate people, which they obviously don't realize and don't recognize and don't talk about. And
Well,
I don't know if I
in
had to
their
just
mind,
live
it's
in
not
it to
even
understand it, but
necessarily hating people, but
no,
it is
in my
playing
mind
into
it is.
It is. Because that's what it actually is. But
I agree, it's
it's
not in theirs.
that us versus them mentality.
Oh, for
Because
sure.
us versus them is what sells books and gets tithes and makes you be the underdog and the scrappy person that everybody's trying to root for. They're not specifically telling you you have to hate people. That's just an undercurrent that you will come to on your own realization.
Right.
But they never told you to do that.
No.
No.
Not specifically.
No, not specifically.
No, but they did tell you that everybody's evil,
Mm-hmm.
right? For all have sinned, right? They did tell you that, and they did tell you that if you want to be saved, you have to do da 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 da. And then they told you all of these. If you believe in that, and if you're saved, all of these things are a sin, right? They told you that. And then they can kind of shift what is this. That was the, kind of the COVID. You were saying they had to change their theology, right? Because
Because they believe in Hebrews, and Hebrews says, "Don't forsake the meeting of one another together."
well, right,
And-
but before that though, it had been such a big deal to honor the government,
Yeah.
and their authority, because God had put the government in authority, and so we're going to obey the government.
Yeah.
But now obeying the government was wrong, so they had to change their theology to make sure that obeying the government was now easier to view as a sin,
Yeah.
than it was as a righteous act.
Well, and it was
a
so
righteous
interesting how they put that in the documentary that we were watching, because these people were having to defend like why they switched from one set of points to a different set of points, like why they stopped listening to mask mandates and social distancing guidelines.
Right.
So they brought up these things as if, oh, I just forgot, I believed that the whole time.
Right.
Ah, yes. I mean, that commentary on the Bible was on my shelf that whole time. Somebody told me I should reread it, so of course I reread it. And it turns out that what I always thought was we should definitely disobey the government on these things.
Right. That is exactly how they presented it.
Yes.
Yeah.
I thought that I was going by these guidelines, but really I had always believed something entirely different. And thank goodness this friend of mine pointed it out and made me remember what I had always definitely known all along, which was that the government is definitely trying to get us to not be Christian anymore and persecuting us, and we should stand
So we
up
should
against
resist.
them.
Yeah. So now I'm going to emphasize all of the points of Christian history where we resisted the government.
Right, but in order to do
Yeah.
that, they couldn't even go back to the founding of America, which would have been the best place to go.
It's true, they went to Scotland.
They went to Scotland.
Yeah, that's interesting.
And they had to do the Scottish Catholicism versus Anglicanism, essentially, where some woman had a three-legged stool. When they read from the Book of Common Prayer, which had been declared to be the only thing that was available in Scotland, she threw her three-legged stool at the pastor who was reading from the Book of Common Prayer as the government had told him to do.
Yeah, they were
Which
like, way to
is-
go, woman with a stool.
Yeah, they were really excited about the woman with the stool,
They
and
were.
they usually have been excited about the woman with the stool, but they took that as the context. Like, religion was the context that they were taking from that. What they were not exploring was that religion was being a tool of the government in both Scotland and England at the time.
Oh, yeah.
And the primary clash there was not religion, it was government. And religion was a foil that they used to make sure that the right people were talking to the other right people at the right times.
Well, and, I mean, so often religion is the foil for political beliefs. Because, I mean, so much of it is just about power and convincing people to think a certain way. And, I mean, it's the same thing now, right? Like, the ultimate goal is, I mean, like, the ultimate goal of the pastors in these churches is, I have to keep my job and keep getting paid, right?
Yeah.
Like, as, you know, having been a pastor, that's a pretty big motivation.
Yeah.
I need to get paid. This is my job. For people who are currently pastors, are going to have a harder time admitting that than me.
Well, because you have to feed your family.
Right.
That's the thing that does have to happen.
Yeah, but and so ultimately, and which is it's kind of sad, really. Like when you think of it that way, like they have to who jump through all these weird hoops to maintain their power, to maintain their livelihood, just from the pastor perspective. But they use and they but so then it becomes, you know, part of the political game, and which is kind of crazy. But that's just because, you know, we humans talk, a lot of the humans I've known talk about politics like it's a separate thing from our lives that we live, right? Like politics is out there and I live my own life.
Yeah.
But the truth is, all these things are connected. You know, they all connect. They're all, you can't drive down a road without having politics, right? They're the ones, the government is the ones that got the road there and made it so that we can all agree to drive on the same side of the road so that we don't smash into each other, or, you know, just as a example, right? But that applies to everything, right? We have to have these things in place because we're a bunch of humans trying to get along in the best, you know, best way we can, which is not always the best way, but we're just all trying, right?
Yeah.
But then, like, and so, but then religion gets thrown in there, and again, it gets thought of as a separate thing, but it's all so tied together, and you know, religion uses politics, and politics uses religion. It's this weird act, I guess, that we're all living out, you
And
know?
one of the things that came out of this was because 2020 was an election year,
Yeah.
and Biden got elected in 2020. So another thing that they were going for was everything has been subverted. That's why a leftist is being elected in the first place. Obviously, we should have more MAGA people in, and all of this is only happening so that they can throw the evangelical people out of politics.
Yeah. Well, and you know, and I think what I see is how motivated people are by a good story. Right? Like, if you can believe a story, or you can get people to believe a story, I'll put it that way. If you can get people to believe a good story, like, there's a lot of power in that.
There is.
And that's what I was seeing watching the documentary, is like this spinning of this, and we all do it. I'm not trying to act innocent. I think storytelling is what humans do. So, you know, I'm not saying I don't tell stories and I don't live out a story, right? Like, but at the same time, seeing this story about leftism taking over, and again, you know, going back to, there's this whole bad group of people, right? And they're just trying to retell this story that's really been being told for a long time in Protestant Christianity. Maybe since the beginning of Protestant Christianity in general, right? There's always a bad side that we're against. And it's just a matter of who are we going to paint as the bad guys in this moment. And clearly they did a good enough job to get Trump elected again. So
They did.
it's a pretty powerful story.
Yeah, they did a very good job.
Yeah.
Kudos to them. But it's just so sad. Because MacArthur's in this documentary, and MacArthur was one of those people who was a saint in our growing up years / Bible college years. Everybody looked to him. He helped set the tone for evangelical Christianity in America at all points. And what he had to say was, oh yeah, we have 80 to 100 people joining our congregation now. Every month, 80 to 100 new people are coming here.
Yeah.
And they still think that they are the underdog.
Right. Well, that's always fascinated me about, especially because like growing up, I kind of saw like this powerful side of evangelicalism, where like I'm going to this mega church with thousands and thousands of people, and the pastor's part of this, the NAE, which like had the ear of the president, and like this is what I saw growing up. Like, I haven't thought about these things in a while. But like, so I saw this like powerful group of people that was, again, as a young growing up person, very involved in politics and making change in the nation, and et cetera, et cetera, et cetera. But then it's amazing how quickly like that narrative, again, that I was just observing as somebody part of it as a kid, so quickly gets flipped to we're being persecuted. And as they were trying to tell me to go into the dark reaches of Africa, and that's where I was supposed to be persecuted as a missionary. But
yeah, well, they may have known some things about you. And like that one, she should probably be not here. She'll do real good being persecuted, or we don't have to see her.
Sounds right.
Oh gosh.
So gives a whole new meaning to praying the gay away.
Oh gosh. We always gave the prayer away. So, then we come to the boots on the ground repercussions of that.
It's me.
Something's ringing. Thank you. The boots on the ground repercussion of that was mostly catchphrases. Catchphrases like, fear is the real virus.
Yeah. Faith over fear.
Yes, faith over fear. That was the one that, I think that was the one that your family liked.
Yeah, my dad did that one.
Was faith
I also
over fear.
saw that on a hoodie this week. Somebody walking down a road somewhere. It's a black hoodie, faith over fear on it.
Yeah, and what faith over fear meant, practically speaking, was God is bigger than viruses, and we should not abide by any government mandates for public health because my faith is more important than your fear about a virus.
Right. Well, and I feel like that really, it paints a really good picture of how they're painting this narrative of how they're being persecuted and they're not going to be afraid, right? Because my belief is more important than this
yours.
Fear of this virus, right? Your belief of what's going on. And they're writing this narrative which stands in stark contradiction to this reality of what's happening. Like just your story of being in the hospital during COVID and how bad it was, just objectively. Watching people die over and over and over again. Like it's just this objective reality that you got to, I don't know if that's the right word, but did see firsthand. of this disease ravaging specifically Colorado Springs, right? Like not even just America. You saw, because because I feel like that's what they're like. They almost made it sound fake in their narrative of faith over fear. Like this isn't actually happening. It's all a lie. They're just trying to scare us by telling us so many people are dying, and yet.
And that's where a lot of the disconnect came between us and our families.
Oh yeah.
Was we would call them fairly regularly at this point because they didn't know we were gay yet, and
Yeah.
when we were calling each other, they'd be like, "Oh, sorry, we can't come see you. It's because of these stupid rules that the government is doing this and that and the other thing for this virus that's not even real." And one of my brothers was supposed to be in like pre-med or medical school at this time, and he believed wholeheartedly, whole chest, that it was a hoax, that COVID-19 didn't actually exist, that humans had been dealing with coronavirus variants forever, which we have, and that this one was no worse than the common
Kernel
cold.
of truth.
Yeah, this one was no worse than the common cold. Nobody could possibly die from it, unless they were already super immunocompromised.
Yeah.
Which, yes, if you're immunocompromised, you're a lot more likely to die from things. Like, just things in general will usually kill you a lot more easily.
Again, kernel of truth.
Exactly.
Yeah.
There were kernels of truth, but the rest of my family believed his stated experience over my lived experience.
Right.
So they still
Because
believed that I was not actually seeing what I thought I was seeing, that I was seeing something else entirely. And just attributing it to that because I was being lied to by
No, I remember
liberal media.
hearing them say things like, "Oh, it's just that the medical community is attributing these deaths, these deaths that are actually because of other things to COVID."
Yeah, that was a big one. They also said that hospitals would get $7,000 for each patient they said died of COVID, so that we were killing people on purpose.
God, I hadn't thought about it in a long time.
They said that anybody who was positive for COVID and died, even of an unrelated cause like a heart attack, that we were, as a medical community, just saying, "Oh, it was definitely COVID. COVID killed them." And that any death in the hospital while COVID was actually an outbreak, we were attributing to COVID no matter what it was from.
Yeah, and again, like you can, and I feel like that's the lived experience of that narrative being played out, right, in people's lives and heads and minds, and it was weird to watch. Well, okay, let me put it this way: you've been working at the same hospital since then, so 6 years now.
Yeah.
Was there a marked difference between COVID and the rest of your time working at the hospital?
Like, in what way? Because there were so many differences, I don't know where to start.
That's what I'm saying, though. Like, it's a ridiculous thing that, like, they're just making it up that COVID's happening right now, right? Like,
yes, every person who clocks in, out of the thousands of people who clock into this hospital, is under the pay of the government somehow, or is just stupid enough to be lied to,
right?
Enough that we are manufacturing a crisis in our own heads.
Right.
And it's definitely not that this unit has 26 patients with COVID out of 28 total patients, and most of them are dying, and that we don't even bother looking at some of our readouts anymore because everybody just descends to the 40s sometimes.
Yeah. Well, and I think that was another narrative that was confusing at the time, and people didn't understand very well, was that the big crisis with COVID was at the hospitals, right?
Yeah.
Where because it was just, there weren't enough beds, there wasn't enough oxygen, we just didn't have enough resources to deal with this crisis.
Yeah.
And so it centered this crisis thing at the hospitals. And I think people have this tendency to shove things they don't want to think about to the back of their mind, right? And hospitals is a big one, I think, for people, where it's like, that's if I don't have to be there, I'm just not even gonna think about it. Right? And so there's this crisis that's centering around hospitals because of that's just how this disease worked, right? Where
you weren't sick until you were sick, and then you were very, very sick.
very, very sick and had to go to the hospital, and the hospital would try to take care of you,
Yeah.
and that affected everything that happened at the hospital.
For example, my unit now has 25 beds. We put 37 people in those beds during COVID. These rooms are barely big enough for what we use them for, and we made every room on the sides and then some more, so we could have up to like 40 people, a double room, which is nearly twice as many people as you're supposed to have there.
Yeah.
And these rooms are not made for this, so much so that if you did bring these people in, which we did for a very long time, you could not have them laying down. You had to sit the person in the bed closest to the door all the way up so the bed would retract just barely enough to bring a second bed into the room. Like, this is not made for it. We became very good at a lot of things, but that was also an issue because a lot of these people will go into respiratory distress if you moved them too much, and you have to move them.
Yeah.
So we would just, in the ICU, we got to the point where we would have to prone people a lot. So like you're in a swimming position on your belly, and it would take 6 of us sometimes to put one person on their belly where we needed them to. It took hundreds of dollars worth of supplies to make sure that these people were moving enough every 2 hours to not die just from an infection from something bad that happened to their skin, essentially.
Right.
It's so stupid to have been on a turn team shift where for 12 hours you were just trying to move people enough that they would not die from pressure ulcers because they had COVID and they couldn't do it themselves and they were on a ventilator.
Right, because if they move too much, they
And then leave, and the radio says,
Die
this
of
is a
black market.
manufactured crisis.
right.
This is so that we won't go to church.
Right. Yeah. Well, that's what I'm saying though. Like it's amazing. It's such a privileged thing to be able to even be able to write this narrative because you had enough privilege to know nothing about what's going on in this hospital. Yeah. You had enough privilege to stay healthy, stay away from it, just enough to believe in this narrative that and while at the same time there's these select group of people working their asses off in ways that
because you were an idiot.
Right, you decided to get people
because
together.
You were an idiot.
Right, and since it's this invisible transmission that they can't see, touch, smell, their conspiracy theory works for them, right?
Right, because they don't have to deal with any of the actual
no repercussions
that happen because of it.
Yeah,
But no, we had a lot of church people dying alone.
Yeah, oh, for sure.
And then it's just me trying to use a hospital iPad to help somebody from across the city figure out what FaceTime is and how to use it so that they can have one last glimpse of that person before they conk it forever.
Right. And I think that documentary was so sad to me because it just meant that narrative still continued. Like they never had to face it. They never had to stare.
They never had to see death.
Essentially, they managed to sweep it under a rug.
Yep.
And that's so sad.
Yeah.
And people died because of it. Like,
they did.
Without a doubt.
A lot of them did, and I met a lot of them or took care of a lot of them. And the thing that gets me is one of the very many things, obviously, because we're doing an entire podcast on this. One of the very many things that gets me is there's a lot of different kinds of death. There's expected deaths and good deaths and pleasant deaths and deaths on your terms and deaths on the terms of your family. We do hospice, and I just love my hospice and comfort care patients. It's one of the most meaningful things that you can ever do to help someone transition or be there for them while they are transitioning into the afterlife. Amazing, amazing time. I love it with all of my heart. If I had any way of becoming a hospice nurse, I would do it in a heartbeat. Spectacular. COVID deaths were not good deaths. COVID deaths were never on the terms of the person dying. COVID deaths were never happy or calm or peaceful. COVID deaths were people fighting up to their very last breath. They died scared, every single one. It was not good. And if you're going to go out, or if you're going to make other people go out on your terms, at the very least, you should have to watch. It's not fair these people had to die with no family members, with no loved ones, with no support. Chaplains couldn't come in. They had an iPad if they were lucky, and sometimes
that was the government's rules.
Yeah, well, and sometimes
that was the government's rules. They were making people not be able to see each other.
We didn't even have ISO gowns, because up until COVID, we had ISO gowns that were paper and you could throw them away. And then we ended up with these, we still have them now, these shower curtain gowns that we have to reuse, because we could not even keep up with what it would take to have disposable isolation gowns for people to be safe. So now you've got some random CNA in a shower curtain, and you can only see half their face, and you're dying, and they're just like, here, you've got to keep this in your nose for 12 hours, and then they're gone. It's the worst way to die.
Right. But it's not just government rules, like they were saying it, like that's the government's fault. It's literally nurses and doctors just trying not to get COVID themselves and die.
Exactly.
The people who have to deal with it every day are trying not to die. You can absolutely
go into a room without a mask or an isolation gown. You can. But you can only go into one room.
Right.
You can't go into any of the rest of them.
Right. And then you can't help anybody else.
And then you can't help anybody else.
Yeah. Right. Which is just germ theory.
Yes.
A very basic scientific principle.
And what evangelicals had to do.
Hospitals have been operating on for decades and decades.
Exactly. What evangelicals had to do was discount Florence Nightingale saying, hey, maybe we should fucking wash our hands sometimes.
Right. Right. That's what I was just going to say. It's the same reason you wash your hands in the bathroom is germ theory.
But then I would go to anywhere, and I have a small bladder. I need to go to the bathroom all the time. I would go into a bathroom. There would be one other person in the bathroom with me because of guidelines. And they would look at me as they were washing their hands and roll their eyes and be like, I guess I have to do this now. I'd be like, what the fuck were you doing before? What is wrong with you? Germ theory is not a government conspiracy.
Right. Nobody has thought it was.
Until
COVID, nobody even considered it.
No, we had to rewrite theology to where
because it saved millions and millions of lives.
Exactly. Hundreds of years of medical practice went out the window in the evangelical mind because they did not think that they could trust doctors anymore. Because all doctors were on the payroll of the government.
Just to fit the narrative.
Just to fit the narrative.
Because God has to be more powerful than viruses, and when it turns out he's not, they have to do something about it.
Mm-hmm.
That's my take.
Yeah.
Tessa's hot take would say.
So.
God's not more powerful than viruses.
I did go to God is bacteria. I did go to church a couple times while this was happening. I did go to church because I was raised to go to church and I tried to go to church. So the last day I ever went to a church was the day after a really, really, really bad ICU day. Several people died. They did not die happy. They were trying to scream and they couldn't scream because their lungs weren't strong enough. Like it was a bad day. And I went into New Life Church the next day. social distancing, masking up, using hand sanitizer for everything. Like, I had one clipped to my belt loop. I didn't even bring the kids because I was too scared to bring the kids. And for the beginning of the service, they said, faith over fear. You can take off your mask if you're comfortable. And then everybody took off their mask. And then they all started hugging each other and heading towards me. Like, oh, fuck. I can't do this. And I have not been in a church since.
You're just afraid.
I was afraid.
How dare you? You shouldn't be afraid.
I was afraid that I would not be able to scream in fear.
It's such an interesting thing that fear is framed as only a bad thing. Because, like, and I have a hard time with, like, working with kids with behavioral difficulties and trying to explain things like this isn't even when anybody's dysregulated. This is just conversations I have with kids sometimes where, like, they'll say things like, I'm scared of heights. I mean, I have it with our kids too, right? Like, I'm scared of heights. It's like, oh, yeah, everybody's scared of heights, right? Like,
that is your amygdala working.
Right.
That's a thing you're supposed to have.
But it's always framed as this bad thing, right? And kids at my job especially, they'll try and use, like, fears of things as to try and, like, kind of like a power tactic, right? Well, I'm scared of that. That's almost like a disease. It's a disease to be scared of something, right?
Oh, no.
That's a whole fascinating topic that we don't need to get into, but just me observing, right? So disease is so, or not disease. Gosh, I'm sorry. Fear is so, like, stigmatized as a bad thing that, like, even our kids start to talk about it like it's a disease. Right? Like, this fear is something I need to get rid of. Fear is something I have to fight.
I will not fear. Fear is a mind killer. I will face my fear. Let it pass through me. When the fear is gone, there will be nothing. Only I will remain.
Good old Doom.
Yeah, good old Doom.
Yeah, we should preach that more. Because we don't understand fear. Like, yeah, you should face your fears and try and, you can push yourself and overcome things. But that doesn't make fear bad. Right? It's actually very important for lots of things. If you just weren't scared of anything, you'd probably walk outside and get run over by a car. Because you weren't scared of getting run over by a car. Right? Like, it's an important part. And same with, if you're talking about a viral disease that's killing thousands of people, you should be scared of that. Right? Because you don't want to die. You don't want your family to die. You don't want your friends to die. Right? That's something you should be scared about and try to approach in a safe way where fewer people are going to die. That's what fear is going to do. It's going to keep more people safe. And yeah, does that mean we should does that mean, oh, well, you should be scared of it? That means we should just let COVID run free and not try to solve it and come up with an answer. No. That's facing the fear is, okay, let's solve this problem, right? Let's quarantine what we have to quarantine. The people who know how to come up with viruses need to come up with viruses. Let's pump money into the places that money needs to go, right? That's facing the fear is just trying to do the right thing, not ignoring a problem. Ignoring a problem is not facing your fear. Like, pretending like it doesn't exist is lying to yourself. It's delusional. That's what I have to say about that. Yes.
Yeah.
Well, and that's what praying over sick people always was. And it bugged me my whole life. Because I was in a very Pentecostal, kind of charismatic church where there was this underlying belief that you would pray over people and God would heal them, right? And I have time after time, I watch people pray for people who were sick or hurt or injured or suffering, and 99% of the time, what happened was what happens to everybody. Where they get better after a while because that's how human bodies work, and we live in a fairly modern society that's pretty clean, and we wash our hands and go to the doctor when we feel sick and have Tylenol and ibuprofen and like that everybody was using, and like it was just, and I watched that, and people would say, oh, it's such a miracle, God heard our prayers, you're feeling better, like and I was always kind of like, okay,
but it didn't work for cancer.
But right, when it came to serious stuff, they would do the same thing
and say it was not God's will.
Right.
You didn't believe hard enough.
Yeah.
Or we should have prayed more.
Yeah, it didn't work for cancer. It didn't work for whatever crazy illness my father had. And my dad ultimately died. Right? Of some combination of weird lack of trust in doctors and bad health choices. And,
Wait,
and trust in the church.
Your dad died of a heart attack.
Well, yeah.
Because your dad believed, among other things, because your dad believed that alcohol was bad and soda was good.
Wow. Yeah, there's a whole conglomeration of things that led to my dad dying. But
there was also a series of mini strokes. He had also been COVID positive and believed that
he also had COVID.
Yeah, but
like just to make it
nobody
really
said he
close
died
to
of
the
COVID,
topic.
though. They all knew that he died of a heart attack.
Right. Which that goes back to that narrative of they died of something else, and they're just saying they died of COVID. That doesn't mean COVID wasn't strongly involved in this process. But again, like most of those people, like if they'd even just got an EMT class and thought remotely at how connected different systems of the body are, they would realize that what they were saying was kind of ridiculous. Because for those of you who've not just even been through a simple EMT class, all of the parts of the body are very connected. The systems are all intertwined and affect each other, and when one is struggling, the other tries to compensate, and it all goes together. You can't disconnect one part of somebody's body from another part and pretend like they're separate things. That's not how it works. It all works together. It all communicates with each other. It's just how the body works. It's not that complicated. Sorry.
No.
Rant.
That is a very good rant. But to start winding this specific discussion down, I wanted to ask if you could have changed one thing about the church's response to COVID-19, what would it have been? But as I thought about that over the past few minutes, I realized there was never a different response that the church could have taken.
That's why we left the church.
Yes.
That's what it said. Yeah, like.
That was the most natural thing for the church to do.
Yeah. I mean, to try to answer that question, I agree with you. But like, in order to try to answer that question, I would have to be like, the church would have to be this totally different entity that
reacts differently to everything.
Yeah. That like, I feel like some people think the church is, or hope the church to be, or want to change the church into, and like I know there's more like progressive churches and accepting churches, and I don't know. I think there are some better theologies out there. At the end of the day, I think I struggle because I don't see how you can tie your theology to the Bible and not get stuck with you're a sinner who needs to be saved by grace. Like, that's just the whole point of the Bible. As far as I know, maybe, somebody out there will probably argue with me, but from what I know, from what I read in the Bible, it's really hard to get out of the Bible without that thought process.
It's hard to have different takeaways.
Yeah. Like, granted, there's some more hardcore interpretations of that for sure, but even light core interpretations, it's still like you're a broken person who needs to be saved. And like that's just such an upside down way of looking at the world to me. And I feel like you're always gonna come to upside down conclusions when you're seeing people as just, oh, you're messed up on your own and you have to have this supernatural thing to save you from being messed up. Like, do I think people, which is maybe ironic because I try to help kids who are having a hard time. Right? Or you work at a hospital where people are sick. But to me, that's just people are humans who face this, for whatever reason, this very difficult life. Right? And that doesn't mean you're just automatically broken and messed up. Like, no. You just need to figure out how to deal with life as best you can. Right? Like, and it's, and to think of it from broken to saved instead of whole to a whole facing challenges, right? It's a totally different way of looking at it. And I don't know how you can face those challenges without starting from I'm a whole person with whatever that means. I'm not saying it's simple. It's not. It's complicated.
Right.
But it's so different from you're broken and you have to be, I don't know.
Saved.
Saved, yeah. Saved is the word. You have to be saved.
The general idea of you're broken means you have to start with fear
For sure.
as your basis.
Yeah. Well, and that's what that theology, that's how you have to believe these narratives of this group's here to save you, that group is to be feared, right? It's born out of that. And it's not, ultimately, I don't think it's terribly helpful.
I would say it is not.
I know. There's people who I would even agree with about a lot of things who'd probably argue with us about that.
Oh, yeah, a lot of people argue about that. My ultimate takeaway, though, would be COVID did not change the church. COVID simply revealed to a few more people who the church actually is.
Yeah. Oh, for sure. Yeah. It's such a mess.
It's a mess.
You know, the one way you might be able to redeem that theology is like the more mystical, you need to give yourself grace and kind of turning it into that more self-reflective mystical thought process. I guess that's the
Ah, yes, so the best way to become a Christian is by being more Buddhist about it.
Right. Yes.
You realize that you're recommending New Agery,
yes,
right?
Yes, I am. There we go.
We've discovered that the problem with the church and COVID is it needs tests.
That's right.
She should have gone to Africa.
I should have gone, yeah.
This has been good, shunned for good reason, or good shunnings, good reasons. I'm Anna.
Om.
And that's Om.
Sure.
And we'll see you next time.